Hello, everyone. On this occasion of the World GNM Day, I will be sharing a little bit about rheumatoid arthritis in the light of GHK. So, disclaimer, this information given in this presentation is for educational purpose only. It is not intended to be substitute for professional medical service. Participants should consult their medical doctors for health reason before using anything that is disclosed during the course of this presentation. Students shall not use any of the different information given in this presentation while writing their examinations. My gratitude to Dr. Samuel Hahnemann, father of homeopathy, Dr. Hammer, father of GHK. So my topic of discussion today is the rheumatoid arthritis. I will explain this with the help of a case. Okay. So when the patient comes to us, what are the main symptoms which he comes? It is usually there will be stiffness of joints, pain in the joints, swelling in the joint. There will be tenderness, as is mentioned here, stiffness, especially in the morning or after sitting for long periods. Pain and stiffness in the same joints on the either sides of the body or on the same side. Along with that, there will be fatigue, weakness. He may come with fever, but it is like not every person will come with same set of symptoms. There will be some differences in the presentation. So what is a pathology? Rheumatoid arthritis is what we call as the autoimmune disorder. So somewhere the immune system is compromised. When your immune system, which is supposed to protect you, is it goes against you and attacks your body, that is the time your tissues get damaged, and that is what this is all about. It causes inflammation in the lining of your joints. As a result, your joint will get red, warm, swollen, painful, and there will be distortion in the later stages, as is seen here in the picture. Causes of rheumatoid arthritis, the exact cause is not known. It is an autoimmune disorders, and there are various things which we attribute could be the cause of the rheumatoid arthritis. Like some experts think that there are viruses and bacteria which change the immune system, causing it to attack your joints and the bones. Then there are other theories which suggest that obesity, smoking, can lead to arthritis. Then the age factor is they consider like 40 years and above usually are prone to get this RA. And if you have a strong family history of RA in your family, then you are prone to get affected. Is what we see in our daily practices. So these are the few causes which the conventional medicine teaches us, or what we are taught in our colleges. To know about the exact cause, so here we take help of the GHK. Now, since we are dealing with rheumatoid arthritis, that is the bones and the joints, we'll study it a little bit from the beginning. So, as we all know, we have studied the human body structure comprises of roughly 206 bones. The supportive part of the bone is the cortex substantia corticalis, which surrounds the bone marrow, and substantia spongiosa. The exterior is covered by substance, which is the periosteum. So this is very important, that except for the ectodermal periosteum, all the structure of the musculoskeletal system, meanings the ligaments, tendons, muscles, the intervertebral disc, menisci, bursae, etc., are made up of the mesodermal tissue. So only the superficial periosteum of the bone is from the ectodermal origin, rest all is from the mesodermal origin. Yes, now this shows clearly that bone and joint are derived from new mesoderm and are controlled by the cerebral medulla. Now, since the bones, the joints, the ligaments, the tendons, the muscles are all from the cerebral medulla, there is the bones in the right side of the body is controlled from the left side of the bone, and vice versa, because there is crossover correlation. So this helps us in framing the question. When a patient comes to you, you have to put in the right question in front of him so that you get the answer related to the suffering of the patient. For example, if a right-handed person has come to you with right-sided complaints, you have to ask him questions regarding his partner, the working partner, the spouse, regarding his property, finances, territory, and father. If the same person has come with the left-sided complaints, then you have to ask him about his relationship or about the responsibilities towards the mother, child, siblings, blood relations. Hmm? Biological conflict. So, biological conflict is the cause linked to the bones and the joints, as per the GHK, is a severe self devaluation conflict or the loss conflict. Now, see, this is the joint. Okay. So, when the cartilage, joint capsule, and bursa are affected, it is self devaluation inability conflict, inability to perform, inability in a particular situation, inability to do something. Similarly, if the bones and the periosteum, then it is a self-devaluation conflict. If there are tendons and ligaments which are affected, it is self-devaluation inability conflict. And if the superficial periosteum is affected, then it is the brutal separation conflict. Now, this brutal separation, because here it is from the ectodermal origin, as we have read earlier, that the superficial periosteum is from the ectodermal and rest all is from the mesodermal origin. Self-devaluation can be generalized or can be a particular thing. So if it is generalized, conflict concerns the whole person. And the conflict is experienced, for example, through humiliation, accusation, scoldings, abuse, which could be physical, sexual, or verbal, failure, a poor performance or feeling of shame and guilt. It could be at your workplace, it could be in the class, it could be at home, it could be anywhere. Similarly, the loss of status, the loss of workplace, retirement, we usually see, when the people are working and they are in a daily routine, they do not suffer. But once they have retired or when they are told to stay home, that is the time the complaints start. So there is a little self-devaluation that I am not able to work, I am not mobile now. So, illness or injuries, aging, or loss of a person who made one feel appreciated and needed are the other conflict scenarios. So, general self devaluation, these are a few causes which are mentioned here. There can be localized conflict. For example, skull. Now, the skull is head, that is intellectual devaluation. The people who are engaged in the intellectual professions, like the lawyers, the writers, the teachers, where they, and you are devaluated at your workplace. When you are intellectually devaluated, the bones and the joints of the skull get affected. Not being able to bite literally or figuratively. This is the cause. When there is stiffness in the mandible, you have locked jaw or you have the pain here, that is the reason. Shoulder is all about shouldering a responsibility. So when you are unable to take the responsibility or you are not able to embrace or hug someone, that is the time the conflict affects the shoulder. Elbow is all about again embracing a person or a pet. Lumbar region. Now, lumbar region is all about support. So when there is humiliation and degradation, degrading treatment associated with feeling of being unsupported by the people on whom you depend or whom you expect the support, then your lumbar region is affected during the conflict. Wrist joint is performance. If there is poor performance at your working place, at home, or you are put down by somebody because you have not performed well, then it is the wrist joint. The knee is all about moving ahead, mobile, to climb the ladder, to climb up or progress. So when that is hampered, your knee joints get affected. feet and ankle is not being able to walk or balance, or not being able to kick away somebody whom you don't want in your life. So when these thoughts come to you that I am good for nothing anymore, I am a burden for my family, I should have worked faster and harder, I do not accept my imperfection, it's all my fault. Why am I not enough? Everyone is better than me. I have done something wrong. I am clumsy. So when you think of such things, you are self devaluating yourself. There is no circumstance, there is no person who is devaluing, but it is loss of self-worth. You feel you are worthless. So this can also impact your joints, your muscles, your tendons. So now we come to the conflict. So what happens when the conflict is there? So that is what we call as a conflict active phase. So whenever you face devaluation or loss of self-worth during the conflict active phase, the affected bone decalcifies. It creates gaps and little holes in the bone, which we call as osteolysis, and this osteolysis depends upon the degree of devaluation, the intensity of the conflict. The decalcification of the bone increases serum calcium. Loss of the bone marrow that occurs together with the bone osteolysis also alters the blood parameters. Then comes the healing phase. So normally when you get stiffness, you get pain, you get redness and all, this is seen in the healing phase. Because when the conflict is active, you do not get the pain. But when the healing phase starts, there are changes around the bone, around the joint, and that is the time when you feel the pain. So what are the changes which take place is the bone is reconstructed with callus produced by bone building osteoblast. The soft new bone is formed, which eventually hardens into hard callus. When the healing of the joint is prolonged because of the continuous conflicts, that is, relapsing of the conflicts, then the bone spurs, means there are small bony growths, which we call as osteophytes. And these osteophytes then restrict the movement of the joint. They cause pressure on the surrounding tissues and nerves and cause pain. And then when it is then that you experience the pain. If the available bacteria assist the reconstruction of the bone, Staphylococcus bacteria are specialized in restoring the bone tissue. So this is same thing expressed in the chart form. That is, there is a perceived stress or the self-devaluation conflict increases the cortisol level. It diverts the blood flow from intestine and kidneys and hampers the calcium reabsorption. So there is less calcium to the bones, which leads to osteoporosis. So before we start the case, see the healing phase of the bones also takes place since it is of the mesodermal origin. There is in the first part of the healing phase, there will be edema and exudation. In the second part, that is the PCLB, there will be scarring. Also, when there are conflict relapses one after the another, the fluid which gets collected, actually it is for healing purpose. It goes towards the superficial periosteum, because of which the superficial periosteum stretches. And as it stretches, because of the stretching, since it is innervated with so many nerves, that is the time you get this excruciating pains, especially seen in the rheumatoid arthritis. Sorry. So this is a case of a 50-year-old patient who arrived with the complaints of RA, which was since 2005 and 6. The pain began with a great right toe and progressed to stiffness and immobility, which was made worse by movement and by evening. She wanted to complete relief she wanted to stop taking her regular medications, the painkillers which she was taking. So these were the medicines that she was on when she came to us. So in her history, what we got was in the year 2004-5, something really sad happened to the young woman. Her sister committed suicide and it made her really upset. She cried a lot because she missed her sister so much. What made it even worse was that sister's husband's family was involved in her sister's death. They used to abuse her. Now, this she came to know later. So, sister passed away. Till then, she was really sad and confused that why would my sister commit suicide? And there were so many people asking, her that what was the reason, and she had nothing to say. She used to feel a little ashamed, and what should I reply, kind of thing. That was really big shock for her. She couldn't believe that people could be so mean and hurtful. The whole incident made her feel ashamed in front of other people. She went to her sisters in laws for confrontation, but they offended her, they abused her, and they asked her to leave their home at once. That is the time she felt really insulted, and without saying anything, she just came back to her house. And it is after that she started experiencing the pain in her joint. Now, she was devaluated, she was insulted by the in-laws, and she did not want to stay there even for a minute. She had actually gone there to confront the in-laws, but after she was abused, she could not speak up anything, and she just returned back. After this incident, she became very sensitive to seeing people being rude or mean to each other. It made her feel really bad inside, like she could feel their pain too. Because of all this, she decided she didn't want to get married. She didn't trust that people could be good to each and other anymore. She felt like she didn't want to be the part of society where people could be so cruel. So she decided to live her life alone, away from all the expectations and judgments of the society. Even though she felt sad and hurt, she tried to be strong and not let it control her life. Means what? She lost confidence in getting married. She lost confidence in the society. She could not tolerate the rudeness. She so thought of being not getting married and staying alone. But at the same time, she did not stop working, or she was not loathing her life, or she was not, though she was in the grief, she saw to it that she overcame it. So what we took was, these are the rubrics: elements from mortification, elements from rudeness of others, sensitive external impressions to all, injustice cannot support, horrible things, sad stories affect her profoundly, buoyancy and emotions suppressed. So we gave her carcinosin 200, 3 doses. She used to take allopathy since years, but the reports never came normal. So she came to us in 2021. That time we had recorded this report where her RA test was positive, and then in the year 2022, it had become negative. Let us hear from her side.
What change? काय चेंज झालं
पहिल्यांदाच म्हणजे अरे निगेटिव्ह म्हणजे आलेला दिसतोय आणि 16 पासून औषध घेते.
2016
She's taking medicine from 2016.
आणि आपल्याकडे
आता ती गोळी फक्त आरती घेते
स्टेरॉइडची, म्हणजे एप्रिल पासूनच आहे ना आपल्याकडे ट्रीटमेंट. एप्रिल जुलै जून 4 महिने. काय काय डायग्नोसिस दिलं होतं डॉक्टरांनी तुम्हाला?
म्हणजे आर पॉझिटिव्ह असायचा, माझा ईसीआर पण खूप वाढलेला असायचा. म्हणजे जेव्हा मी पहिल्यांदा इथे जेव्हा आले तेव्हा त्याच्या आधीच्या रिपोर्ट मध्ये माझा 116 का काहीतरी.
आता
एकदम कमी झालाय, 20 झालाय.
She is also shocked and astonished and surprised. एवढा कमी झाला.
What change?
So of course we gave her the treatment, but along with that, we have to determine the conflict or the tracks, and if possible, resolve them in real life. So you have to tell the patient, make the patient aware of the circumstances or the situations because of which she fell into that situation, or she felt the pain, and why she got the RA positive. Also, along with that, we advised her alkaline diet and sun exposure, then putting the feet on natural soil, all not natural things, which will really help her in completely healing her. And now she's completely out of it. Thanks to my extended family team, Usher Clinic, for helping me with preparation of the slides and completing this in the time schedule. Thank you all.